first episode of Happy Birthday Wellness Quiz, Day 167, your health promotion and disease prevention podcast brought to you by Kike Afya. My name is Biri Ogwogo. I'm a medical doctor and specialist in public health medicine. I'm also the host of this podcast. So how much sugar should you consume in a day? Now I'll tell you in a while. Now to kick us off, here is a short quiz for which I will share the answer at the end. Recommended dietary allowance or intake for free sugars is 10% of the total daily calories or 200 calories for a 2000 calorie diet. This is according to World Health Organization. Now this is equal to A, 5 teaspoons of sugar, B, 1 teaspoon of sugar, C, 12 teaspoons of sugar, or D, 15 teaspoons of sugar. Now, sugar is a very big topic, but I'm just going to summarize briefly in the next few minutes. Now, when we talk about free sugars, we're basically referring to all sugars naturally present in things like honey, syrup, fruit juices, or artificial or processed products added to food by manufacturers during cooking or by consumers. Now, the WHO recommends a daily allowance of 10% of total calories, which comes to about 200 calories for a 2000 calorie diet. This is equal to 12 teaspoons of sugar or 15 grams of carb. Now, how to convert from calories to carbs? Just remember that 1 gram of carbohydrates, and sugar is a carbohydrate, is equal to around 4 calories. So 4 times 50 gives me 200 calories. However, it's recommended that if you can take as low as 5% of total calories from sugar, that is, you get even more benefits. Now, on average in the US, an adult consumes between 22 to 28 teaspoons of sugar per day. That's between 350 and 440 empty calories. This mainly comes from sugar-sweetened beverages, desserts, and snacks. But remember, these calories don't just sit there. They're going to contribute to weight gain by converting the sugars into fat. Now, in terms of the impact on health, when we talk about table sugar, we're basically talking about things like sucrose, and it mainly consists of fructose and glucose. Now, fructose, which is one of the components of sugars, is in majority of any sugar, increases liver, muscle, and visceral fat. Excess fat, wherever it's located, will increase the risk of insulin resistance and diabetes. This happens because, first of all, you're increasing the amount of calories you're consuming, and because you're consuming it as a liquid, it's rapidly absorbed. So you're absorbing quite a lot. This leads to overweight as well as metabolic changes, which leads to diabetes. Fatty liver and visceral fat has the greatest risk. And we talk about visceral fat, we talk about fat in the abdomen, as well as the fat that is packed between the liver, pancreas, and other organs. Now, a common misconception that people with diabetes should not enjoy sugar at all, either as snacks. However, they can enjoy small portions of sugar-containing foods within the context of a balanced diet comprising of proteins and fats. Because what matters is the total amount of carbohydrates consumed, and they should not exceed that. Now, so in talking about sugars, let me just give a bit of background. Carbohydrates can be divided into simple carbs or sugars and complex carb. Now, complex carb includes starches and fiber. Starch is the storage form of glucose in plants and found in things like bread, grains, nuts, seeds, legumes, as well as fruits and vegetables. So fiber is the non-digestible remnant of starch, and fiber doesn't increase our blood sugars. So sugars include natural sugars from fruit, milk, and added sugars. For example, sucrose, which, as I mentioned, what is known as table sugar, is 50% fructose and 50% glucose. Now, commonly used sweeteners are mostly a combination of fructose and glucose. What really matters are the proportions. Now, most people have this notion that some sugars are healthier than others. For example, they can tell you natural sugars from honey is healthier. Now, on the contrary, a sugar by any other name is sugar. And all added sugars have negative metabolic effects, which I mentioned. They increase your calorie intake, cause overweight, and then they lead to metabolic changes such as diabetes and insulin resistance. Remember, all sugars are eventually broken down into monosaccharides, such as glucose and fructose. 1 teaspoon of sugar has 5 grams of carb, which is 20 calories, and 1 tablespoon has 15 grams of carb, which is about 60 calories. So it's good to remember those figures. But remember also, a 12 ounce of soda is equivalent to 9 teaspoons of sugar. So just consuming 1 12 ounce of soda, you've already consumed almost your daily recommended allowance. So briefly, sugars can be divided into sweeteners, and then sugar alcohols, and then sugar substitute. The only difference is that this so-called sugar substitute or non-sweetened sugars is that they don't add weight or cause cavities or increase blood sugar, but the taste is good, and they can be used for people who want to get the sugary taste without the calories and the carbohydrates. So this sugar substitutes include things like saccharin, aspartame, things like sucralose. So for example, sucralose has 600 times sweeter than table sugar. Things like aspartame is 200 times sweeter than sugar, and saccharin is about 700 times sweeter than sugar. So meaning you use very little of it, and then you get the taste of sugar. Sugar alcohols sometimes I found in items labeled sugar-free or no sugar added, but that should not deceive you because they provide calories, half the calories found in normal sugar. So they have an impact on blood sugar, but the impact is less. So they include things like sorbitol, things like mannitol. So be careful when reading the label. Now the sweeteners, as I've discussed before, the so-called sugars, will increase your blood sugar and body weight. So they can increase your weight, cause dental caries, as well as if you're diabetic, they can actually shoot your sugar up. They come in different names, and we've discussed table sugar, brown sugar, molasses, dextrose, maltose, sucrose. If you just see OSE, just know that it's a sugar. So let's look at one of the nutritional facts labeled for a packaged product, and so that we can interpret how much sugar there is there. Now, what's important if you're reading a nutrition facts label is to look at the serving size, the serving per container, and the total fat. Now, if you look here, the serving size is 3 pieces of 90 grams. The serving per container is 3. The container has 3 servings. So which means if I consume everything in this container or in this package, I'm consuming 9 pieces of the product. If I consume 1 serving, I'm consuming 3 pieces. Now, if you look here, 1 serving has 30 grams of carbohydrates. Meaning, if I consume 1 serving, I'm getting 30 grams of carb. If I consume everything in this packet, I'm getting 90 grams of carbohydrates. Okay. Now, we want to convert this into calories, and this is what we do. If you look here, the total carb is 30 per serving. Dietary fiber is 3 grams. Sugars is 2. Now, these 2 figures are already included in the 30. But here's the thing. Fiber, as I mentioned, does not contain sugar, and it's not absorbable. So for me to know how many grams of carb are here, I subtract 30 from 3 to get 27 grams of carb. So this package has 27 grams of carb. And as I mentioned, 1 gram of carb has 4 calories. So I multiply that by 4, and that gives me a figure of around 186 calories. Now, if you look at this 186 calories, it means if I consume only one serving, 3 pieces, I've already consumed 4 times the limit for my sugar, because we said the recommended dairy allowance is about 50 calories of free sugar per day. So 50 times 4, it's almost 3 times the serving. This is what you have here, 200 calories per serving. So it's good to be able to read the label, because remember, you could end up consuming a lot of calories without knowing. And I said these calories don't just sit there, they are converted into fat. This adds weight and can lead to medical complications. So back to our quiz. As I mentioned, the recommended allowance is 10% of total calories, which is about 200 calories, which gives you about 12 teaspoons of sugar, and that's about 50 grams of carbohydrate. So be careful when you're buying packaged foods, and remember to look at the label. This podcast was brought to you by Kike Afya. My name is Subirio Bobo. I'm a medical doctor and specialist in public health medicine. We rely on well wishers to bring you this content, and you can support us by either liking, commenting, sharing, or subscribing to my YouTube channel. You can also support us in other ways through our M-Pesa till number 766-500 or mobile number 0720 95 82 50. This is basically to help us reach more people with this health messaging. Until next time, bye-bye.